and what do I need to do? And you basically do that, and you apply to the Pakistani Indian consulate, and they say, can you please send us a photocopy or a scanned copy of your passport? So you're not submitting your passport directly, but you're submitting a scanned photocopy or a scanned copy of your passport, and you send it to the Pakistani consulate. Pakistani consulate receives your copy, processes the information, issues you the visa, and lets you enter the country, right? Now apply the same principle to DNA and RNA technology. DNA is where the actual genetic material is. RNA is a messenger. It's a copy of a part of your DNA, which you instill in the form of a vaccine into your arm. Your body recognizes it, creates antibodies, and creates a defense system against it. Another simple example I can tell you is that, let's say there is a tornado warning in your community, okay? And people, you are watching TV, you're watching Netflix, and you have no idea there's a tornado warning going on, all right? And you get a text message on your phone from a friend of yours who says, hey, Tabassam, do you know there's a tornado warning? Please take precautions. What will you do? You will have a heightened reaction, you'll panic, you'll be fearful, you'll freak out a little bit, but then you will gather your belongings, you'll gather some water supplies, you'll gather your children, you will go to the basement and you'll protect yourself. Now apply the same thing to the vaccine principle. If there is a virus, which is a tornado around the whole community, all right, you get a text message, which is your mRNA vaccine. It's a message that your body receives in a form of a vaccine that, hey, there is a COVID-19 threat going on. I am giving you the message. So your body gets the message, your body starts creating the proteins that kind of mimic the virus. So you're fearful, you're freaking out. And as a result of that, your body starts creating antibodies, a defense system that you are trying to create to protect yourself from the tornado. Now, the tornado may not affect your house, may not cause a lot of issues, or it may just come around you and cause some very mild damage and go away. That's the whole principle behind it. The idea of having a vaccine, mRNA vaccine especially, is that it basically causes your cells to receive a message. That message is to create a COVID-19-like protein, not the virus itself, not the DNA of the virus, just a message is received into your body to create a COVID-19-like spike protein. As a result of that spike protein, your body realizes, hey, I have this protein which does not belong here. Let me create an antibody response. So they create the antibodies to fight the protein. So as a result of that, you have a little bit of soreness, you might have a fever, you might have some chills, some mild side effects, you get over it. But God forbid, if you were to catch COVID-19 in itself, you will have enough antibodies and response in your system to fight that infection instead of waiting to kind of, create an antibody when you're under attack directly. So that's the whole concept behind it. The reason I gave this very simple or kind of strange example is because a lot of people, whether they're in our community or even in the, people around the world, they think that this vaccine is injecting some sort of a genetic material in our body. It's going to alter our DNA. It's going to have long-lasting effects. That is completely false information. It's a message. It's an mRNA that has been created in the lab. It's not the actual virus. It's not the DNA of the virus. It's a self-destructing mRNA technology that is created in the lab that resembles or mimics what the virus looks like. And it creates a response in our body so we can create the antibodies. That mRNA in itself gets destroyed very quickly and in our body. So it doesn't stay in our body. It does not affect our DNA. It does not inject anything in our body. So there's no virus entry. There's no DNA alteration. There's no genetic material of the virus. It's basically a protein that is created as a result of that message that creates a response system. And that's why the new technology is here. And that's why we think it's effective in creating such a robust mechanism of immunity that we need to fight the infection. Second misconception is, if we get the vaccine, we are not going to get COVID. Absolutely no. Just because you have gotten the vaccine doesn't mean you cannot get the infection. For example, when a tornado hits you, it doesn't mean you're going to die from it. Yes, it's possible it's going to come by next to you. It may cause some damage here and there. It may cause some illnesses. But the point is that if you're going to create a good response to protect yourself against the COVID by getting the vaccine, when the virus itself attacks you, you're not going to become as sick as other people who might not have gotten the vaccine and will become much more sicker. So that's a second misconception that I wanted to clarify. Number three, like I said, it's a protein spike that is caused in your body. So there's no genetics involved over here. So there are no supposed long-term side effects from this. Okay. Number four, a lot of people feel that if we have been vaccinated, if we have had COVID before, maybe we should just not get the vaccine. The point is, even if the antibody is created in your body by actual natural infection, it's possible that you may not be able to protect yourself against the new variants that are coming out there. Same thing applies to vaccines too. Right now, what we know is with the Omicron threat coming along, that if you are someone who's gotten the vaccines, you should be getting boosters down the road, because we don't know how long the antibodies last. And again, this is not some new information. We've known this for decades. If you remember, flu vaccine, the flu virus comes out every spring, every fall, essentially. And the effect of the flu virus lasts only 4, 5, 6 months. Same thing applies to COVID-19 too. The vaccine has been given and the effects are lasting 6 months, 7 months, perhaps a year. We don't know how long the effects are lasting. That's why the boosters are being recommended to provide adequate immunity. That's why the concept that you have gotten natural infection will protect you, it doesn't apply as well, because now with Omicron, we are seeing that people who have had COVID in the past are also getting infected with this new variant. So that's why it's very important to get vaccinated, even if you've had an infection in the recent past. Those are most common misconceptions that come to my mind that I wanted to kind of, lay out the, foreground in front of you. And Dr. Mirza, you are up if you want to kind of elaborate further more about children and the effects and the reason why children should get vaccinated. And I'll mute myself.
Assalamu alaikum, everyone. First of all, I want everyone to know that in terms of vaccines for children, this is a very no judgment zone. We are not here to tell anybody to vaccinate or to not vaccinate. This is just to answer questions and allay any fears that any of you may have. And just like vaccines, a little bit more like Dr. Nafsi mentioned, mRNA vaccines are not a new concept. The rabies vaccine is an mRNA vaccine. Zika virus is mRNA. RSV, something that affects kids, is also an mRNA vaccine. So this vaccine, yes, it is new, but remember, we're in a pandemic. Because of that, because of a pandemic, none of us have lived in a pandemic before, this vaccine has been developed in a very rapid manner. A lot of resources from a lot of countries were pulled together. So that's a little explanation of why usually it takes 10 years or 8 years or how many ever years to approve a vaccine, why it was approved faster. The other thing to keep in mind is sometimes, just like chickenpox vaccine, when it first came out, it was not required. And then we thought we would only need one vaccine. Now, as you may know, all children, they need 2 doses of the vaccine. So when the vaccine for COVID first came out, they said we need 1 vaccine. Then we got another dose, and now we have a booster dose. So it's very evolving. The information changes day to day. And yes, you could make a case that, well, I've already had the COVID virus. Why do I need the vaccine? Just like the flu, we get a flu shot every year. Even if you have the flu, if you've had the vaccine, your symptoms are less severe. Getting the flu vaccine is not going to give you the flu. Same thing with COVID. Getting the COVID vaccine will not give you COVID. Other things being said, yes, it is true that kids do not usually have as severe side effects as adults, but we can't calculate or predict which child will have a bad side effect. If there's 1,000 kids, 1,000,000 kids who are going to have COVID, we can't predict which one will be the one that's going to die. Okay, we can't predict which one is going to have a heart attack, heart failure, or multi-system disease. So if it were my kid, I don't want that chance. Is he going to be the 1 in 1,000? I don't want to pick. So that's my rationale for why I would want my kids to have the vaccine. The other thing is, as far as side effects, the immune system in children is very different. If you think about it, we give them a lot of vaccines. We give them the hepatitis shot at birth. We give them shots at 2 months, 4 months, 6 months, 12 months, 15 months, 18 months, 4 years, 11 years, 16 years, and then every 10 years. So if you think about it, kids get a lot more vaccines than adults. And I'm sure through all your reading, everyone's on Google, everyone's checking the CDC website. There is a lot of information on side effects of the vaccine, what's in the vaccine, how many kids get the vaccine. But no one can tell you 100% if your kid is going to get a fever or not. Will they have soreness or not? Yes, they will, most likely, but they'll get that at the 2-month shots. They'll get it when they get the chickenpox shot. Some kids act fine. They're ready to go play. Some kids want to sleep. Some kids will say they have a headache. So it's very hard to predict. So if you talk to your pediatrician, no one can give you a guarantee if your kids will have symptoms, and if so, how severe they're going to be. So we can just tell you what we know and share information that you know. In this era of social media, everything is at your fingertips. It's not like before where you have to ask the physician. You can look things up yourself as well. So the other thing to keep in mind is people question, one of the questions that came up was female infertility, period, aberrations, and dysmenorrhea. The vaccine has honestly not been around long enough for us to give you information on that. However, in the scheme of things, a shot, when the academy or any entity recommends that the shot is a good idea for pregnant women, it's usually a good idea for the general population. In the research world, pregnant women are treated as the untouchable sample of everything because we don't want anything to affect a pregnant woman. So when they come out with a stance saying that we recommend pregnant women get it, then it's kind of a lesson for us as adults, as seniors, as parents of little children, that it's very strongly recommended. Again, that being said, we do not want anyone to think that it's without risk. Any vaccine is with risk, any vaccine. So, but at the same time, you have to weigh the risk and benefits of getting COVID, having long-term effects of COVID. Also, people want to travel, people want to go to school. We've noticed since the pandemic started, schools closed down, daycares are closed. The minute one person gets COVID, we have to do contact tracing and we have to limit exposure. So a lot of you parents have kids in Hadi school. So if there's an exposure in class, guess what? Your child has to come home and they cannot go to school. So definitely online school is an option, and that's more than welcome for anybody to avail of that. But keep in mind, the more people that get vaccinated, the transmission rate decreases. You're also less sick. So it's a good way to return back to normal for us. Any question? Let me just look. I think we might have some questions in the chat. Okay. I don't see, if any of you have any questions, you can post them or you can let Miss Vanita know. But also something to keep in mind as we go forward, just as employers are requiring COVID vaccines for their employees, there is a possibility in the next few years we might be seeing schools require COVID vaccination, or you might have to provide proof for, and also for quarantining later. So for example, if your child has had their COVID vaccine and someone's exposed, they may be allowed to go back with mask mandate in place. However, if they haven't had the vaccine, there's a possibility they would have to stay home and quarantine. So these are all possibilities that may come up in the next few years. And it will cause a little bit of confusion because they'll have to keep track of who's vaccinated, who's not. And then, of course, it affects everyone's work schedule, home schedule, and anyone that has any elderly or immunocompromised people at home, family members at home. You have little kids, big kids. You might have an aunt, uncle, parents, in-laws, things like that. So these are all, there's a lot of social ramifications too. So that's something to keep in mind.
Doctors, I believe we have a question from Sister Nazneen, if you want to unmute.
Yes, Assalamu alaikum, doctor. I work in the home healthcare, and I have personally visualized all the ramifications with COVID, and all the patients who actually passed away, all the seniors. May Allah peace, send them peace. And but I have this question for my family, because there is like, they're following a lot of things and they're so confused, because there is, on one hand, there is like myths and controversial talks about this vaccination, and then there are some controversies where they say, okay, it's it connects with religion, and they say that it's Dajjali and all of that, and then they don't want to take it because it is creating a magnetic field, and then they will make sure that we follow it. Like they are saying that they're putting a magnetic chip into the body, and then we are to, we will be controlled by this evil spirituality. How is that, or like demon, I can say, how does that fit into this kind of environment where we are in, where 50% of the population say things like that, and then, you know and I personally have visualized all the patients who actually have passed away with COVID, in the assisted living, in the facilities, mostly targeting all the seniors. um, how can we explain some of these people who are thinking that there is a big, huge conspiracy behind this vaccine religiously? And we as Muslims, what is our right of duty in this type of situation?
Dr. Mirza, do you want to answer that?
I think I'll let you answer that, and then I'll add in if there's anything. I'll let you take this.
Oh my gosh. Okay. So I can tell you that this concept is not unique to our fellow Muslims alone. I obviously, as I mentioned, I work in Rockford, so I see a lot of Christian community as well, and I'm seeing or hearing similar notion from the people from the Christian community, so to speak. So the concept of all this demon or this whole parallel, concept that people talk about magnetic chips in our bodies and the way to control our bodies and how things move forward. Ultimately, I think it boils down to how strongly your belief in the medicine and science world essentially is, whether you have faith in it or not. And I don't know, I mean, actually, we all know why, but in general, for the most part, I would say that this whole concept of COVID-19, how this was handled and how the vaccines have come about, have become such a political, religious debate for various reasons that it's very difficult to, change people's minds. I would say, either you're a believer of science or you're not a believer of science. I think ultimately that's what it boils down to. Either you believe in the, concept of medicine, the concept of healing that science often provides to. It is not anti-God. Science is not anti-God. I'm a Muslim and I'm a believer of science because I believe that Allah has created science for us to understand and to deliver the help that is required. They're all in sync with each other. So I'm not one of those people who will say that I don't believe in this and because I'm a believer of science, I'm anti-God or something. So let's just clear this out completely. I believe they both are in sync with each other. But for the most part, I would say that it's very difficult to kind of make people believe in something that they strongly have a disbelief of, and that is what science eventually is for them. So when people are saying, is this a magnetic chip or something, I can just tell you, like I told you, I gave my whole introduction about how the vaccine is, and the reason for that is because I hear all these things all the time. I cannot change people's mind. And Nazneen, to answer your question, I don't think you'll be able to convince people otherwise who do not want to believe in what you have to say. So there's one concept that is there. The second thing is the vaccine has been there for years and years and years. The technology has been there for years and years. A lot of people who are talking about this new technology, as Dr. Mirza was saying earlier, it is not a new technology. They have had this technology for almost 10 years, even 10 plus years, essentially. In 2016, Moderna, the company that made the Moderna, the mRNA, one of the mRNA vaccines, was doing a trial with Merck, looking at mRNA vaccine technology with some solid tumors, with lung cancers, pancreatic cancers, and colon cancer. They were actually working actively on the mRNA vaccine technology to merge it with one of the drugs, cancer drugs called Keytruda. And they were working on it in 2016. A big thing was about to come. And then suddenly, COVID-19 hit us, and they had the technology, they had all the paperwork that they needed to create the vaccine. So when some people who are, I would say, disbelievers of science, when they come out and say, how is it possible that, within a year they were able to create the vaccine? To them, my answer is they were working on it for decades. They were very close to coming out with something dramatically for on this technology on this front. Anyway, Moderna was already in the market doing this 3 years before COVID-19 came. So this is not a birth of some mystery company that suddenly decided that I'm going to milk the community and by putting magnetic chips and whatnot. No, they were already out there working on it. And it just so happens that, the vaccine, the COVID-19 pandemic hit us, and here we are. And they had the technology. They already knew what to do. They just kind of diverted all their efforts into creating something which is supposed to help in the pandemic. And we have a vaccine that works now. So that is one aspect of it, in terms of how to answer that question as to how quickly the technology became available. It is not some sort of a mysterious conspiracy that they're trying to inject anything among us, so to speak. But like I said, at the end of the day, Nazneen, to answer your question is, there are people who always will not believe. And if you look at some documentaries from 10 years, 15 years, 20 years ago, even with the HIV pandemic as it came along, and even before that, talk about, I'm sure many people are here from Pakistan, and, they will know this, that in Pakistan, Afghanistan, and Nigeria, these are the only three countries where people are very anti-polio vaccine. Polio is alive and very much present in Pakistan, Nigeria, and Afghanistan. Why? Because people over there 10 years ago, 15 years ago, created this conspiracy and this myth that for some reason, government will come, put these drops in your kid's mouth, and you will all be infertile. Right? And guess what happened? They stopped vaccinating the kids. And this disease, which we do not even see in US anymore or in the Western world anymore, is so much prevalent, so much present because of all this disbelief and rumors and conspiracies and anti-God, anti-birth, anti-fertility kind of campaign that goes along. In Pakistan, for crying out loud, they've been killing polio workers. The vaccine people, they go to their homes, people have been killing them in remote villages in Pakistan. So, how do you argue with that? There's no argument. It's just like, this is a vaccine, we know it works. I think education plays a major role in this. Belief, faith plays a major role in this. I think faith in science is very much needed right now, along with faith in God.
Yes,
I think
yes,
I think the other question is, a lot of times there's a lot of fear and there's a lot of lack of control as parents, as people who we get up, we go to work, we take care of our duties at home, to be told you have to do this. No one likes being told that. So what I realized in our patients when they come in and they come in saying, I'm not going to do the vaccine, I say, okay, that's fine. And they're just shocked because I think they expect anyone in the medical world to argue or judge them or say something like that. And then I say, okay. And then they ask me, well, did you get it? Did your kids get it? Did your mom get it? And I say, yeah. So a lot of them do change their mind. The other unfortunate reality is a lot of people who decide they don't want it, when they are confronted with a situation where a loved one gets sick or passes away, or someone then it changes. And it's very sad, but sometimes I tell them, I said, all it takes is one person you love, one person Then suddenly you hear stories, you've seen news articles of, I wasn't going to get the vaccine, then my wife was pregnant and she died, or the kid died, or there's a lot of pro and con stories on the media. But when it takes something like that, and then you wish you could rewind and say, gosh, it was just a poke. We could have gotten this. We do everything else. Kind of like a tetanus shot. You get a tetanus shot every year because you want to make sure you don't cut yourself, or you're working in the farm, or you're cutting a can. It's just one shot. But again, not to downplay anyone's fears, but mostly vaccines are usually not going to kill you. They're going to save you. That's pretty much the message people need to understand. However, COVID, it can kill you. Yes, there's a chance you might not die. A lot of my patients, my youngest patient, 9-day-old baby, has been diagnosed with COVID, diagnosed last week. So far, the baby's fine. The mother is stressed. She's scared. Now, I'm not going to go into details if mom got the vaccine or not. It's a moot point. But no one could have predicted this. Who knows where the baby got it from? People are in the hospital. There are a lot of situations, but majority of our patients are fine in the pediatric world. They're not hospitalized. But I'm not at a tertiary care center, so everyone else that would have gotten sick would be transferred to a larger hospital. However, knock on wood, a lot of our pediatric patients are healthy. They survive, even adults. But again, if it were me, I would just ask, do I want to take that chance? My mom got vaccinated, true story. She got 2 vaccines and then she got COVID. She didn't go to the hospital. She's fine, alhamdulillah, but she told me, and I told her, I said, Mom, you know what? If you didn't get the shot, you wouldn't be here, would you? I mean, we're very open. And she said, yeah. I mean, she ended up not going to the hospital, but this is serious. And when you're traveling, people are going for Hajj, Umrah, Ziyarat, and you're going, eventually you're going to go to a party someday. Eventually you want to get back to normal. No one's going to stay in a bubble forever. And the problem is the social ramifications we are seeing. All these kids and adults that have lost, a year of college, a year of school, you're at home working, trying to do your Zoom meeting and handle your kids. We're falling behind intellectually. We're falling behind socially. The amount of depression, anxiety, suicidal ideation we're seeing is immense. In fact, when people come into our office, I'm treating less pediatric issues. I'm listening to the mom with her issues, dad with their issues, the kids with their issues. I mean, the social ramifications are a lot. So I think a lot of pediatricians are concerned is we don't want schools to close again because it's going to be hard for people to handle. People are worried about handling work and home and juggling kids. So there's a lot of other things to consider as well too.
But I will also, add to this, Dr. Mirza, that, what you just said about the impact of COVID infection itself, even in adults, I would say 10% people are the ones who are going to become sick and come to the hospital, and perhaps 5% are the one who are in the ICU. And I will give you a different example. When I am doing a procedure on a patient, I'm like removing, fluid from their lung. I will tell them that, hey, you know what, I'm doing a procedure on you. There's a 1 in, let's say, 100,000 patient who will get that complication, perhaps, right? And the odds are that it's like, like I said, very low risk. But are you prepared to be that one person of the 99,000 people who will get this procedure done? Same thing applies to the vaccine and the virus infection itself. Yes, the 90% people will be fine. Only 2% will end up in the ICU. Are you prepared to have your child, your father, your mother to be in that 2% patient category? A couple of points I will also make to that effect about the vaccination is, like I said, I work in adults, of course. Before the vaccine, stories was different. But right now, after the vaccine, I would say 85% of all COVID admissions to hospitals across Illinois state and across the country are unvaccinated. 95% of all COVID admissions to the intensive care unit of people who are on the ventilators are unvaccinated. And that is a very large number, so to speak, because we are seeing infection going around in the community, but people who are unvaccinated are the ones who are being hospitalized in massive numbers, who are ending up on the ventilators in massive numbers. And again, at the end of the day, when they become sick, and these people are, let's say, vaccine naysayers, they don't believe in the vaccine, they don't want to get the vaccine. But when they are sick, they're asking for the drugs that were made after the vaccine technology came along. So you're requiring or requesting treatment, which is anti-inflammatory treatment, which is only 6 months old, not FDA approved, yet you do not believe technology of the vaccine that was there decades ago, but just became available a year ago. So the treatment that is available for vaccines or for the infection is actually far more newer than the vaccine in itself. So it always baffles me sometimes when there's so much apprehension in wanting to vaccine. Then once you get the infection, you want the state-of-the-art, perfect treatment, top of the line, the newest drug, FDA approved, not approved, trial medication, trial drug, give me anything, save me. Then get the vaccine too, I would say.
That's a very good
doctor.
point.
Yes, doctor, I
much.
agree to that. Yes.
Thank you so much, doctors. We have one more question over here about the Omicron. As new variants are coming in, what would be your advice? A vaccine targeting Omicron should be administered to kids or given the current ones? Already the kids have been waiting since the pandemic started.
Well, I think first of all, we always follow the guidelines of Academy of Pediatrics. So until a vaccine comes out and is approved and gets their stamp of approval, we would right now stick to the current vaccine. So right now, there's no other ruling that we would follow. Right now, it's better to get a vaccine than something that's not approved that we don't know anything about.
And for the group, I will say this: my child is turning 7 tomorrow, mashallah. He's my firstborn, and he got vaccinated. Just with COVID, whatever was available, the Pfizer shot he got, and he got it. And I'm eagerly waiting for the vaccines to be approved for 2 years and above, because then I can have my other children vaccinated too. So it's not something that we are just preaching; we are applying it to our families too.
Yes, ironic. I agree with that. In fact, incidentally, when Hadi School sent out the survey that would you like your kid to be vaccinated at school, I said, sure, fine, because I worked far away from home and I wouldn't be able to take my 6-year-old. And I was appalled at the results where no one wanted to have their kid vaccinated at school, because it's just more of a hassle. I have to figure out to take her somewhere and get her vaccinated, basically. But it is what it is.
Perfect. Are there any more questions? If not, we will allow the doctors to go. No more questions?
I'm happy to answer any questions on the chat if they come along later on also. If you feel like they missed it or they look at the recording later and want to directly be in touch, I'm more than happy to answer any questions.
Yeah, same for me as well. We can definitely answer questions later if someone wants to message us or something. That's fine.
Perfect. I guess we don't have any more questions here. So I want to thank both of you for your time. This was a very informative session, even for me with 2 little ones under 3. It has me really thinking in for the future. And I really feel you guys were very honest and had the science and the faith behind it. So I want to thank you both for your time, and inshallah, Allah will reward you for all your hard work towards making our communities healthier and for your dedication towards Hadi School of Excellence. So thank you both so much. Inshallah, you have a great night, and thank you everyone who has attended.
Thank you. Assalamu alaikum.
Wa alaikum assalam. Muhammadan wali Muhammad.
Thank you.
Khudafez.
Jazakallah khair.